Did you know that your heart might be sending silent and dangerous signals without you realizing it? The truth is that 98.2% of people ignore crucial symptoms, believing they are just fleeting annoyances, and this can lead to fatal consequences. Excessive fatigue, that sudden chest pain or pressure, or even unexpected swelling. These could be the first signs that something is wrong. It may seem like everything is under control, but your body is giving you warnings that we often overlook. The good news: by recognizing these signs in time, you can prevent a tragedy and protect your health. Today, I'll reveal the 7 signs of heart problems that could be fatal but are unknown to most people. Don't ignore these warnings. Your life could depend on it. Before we discuss the first sign, there is always a solution you can adopt at any time to finally resolve your heart issues. Have you ever found yourself worried about your heart health, feeling that despite all your efforts, you're not doing enough? Imagine if you could follow a clear and simple plan that, in just 30 days, could transform your heart health. Considering the challenges of keeping heart health in check, I've made my ebook available, 30-Day Heart Health Challenge, 30 Steps to Clean Your Arteries in 30 Days, and I've left it for you to download right now in the pinned comment. This 30-day challenge is not just about superficial changes. It's about ensuring your heart is stronger, your arteries are cleaner, and your life is longer and healthier. These are habits that anyone can implement, no matter how busy your routine is. And the best part, these habits can be easily incorporated, becoming a natural part of your daily life. Click on the pinned comment, as we have very few units left and we'll be taking it down soon. Click now and grab your ebook. 1. Frank's sign. Imagine the scene. It's a lazy Sunday, and you're in the kitchen, preparing a simple and delicious breakfast. While stirring your coffee, someone asks you about a small line that has appeared on your earlobe. It might seem like a harmless mark, but in reality, it could be an important warning from your body. This line is known as Frank's sign, a diagonal mark that can appear on the earlobe. It might not be something you see every day, but it's a clue that your body is trying to give you about your heart health. It all started back in the 1970s with a doctor named Sanders Frank. He was observing patients and noticed a curious pattern. Many of those with artery problems, like blockages and obstructions, had this diagonal line on their earlobe. It was as if this tiny mark was an invisible warning sign, a kind of secret code that your body uses to alert you when something isn't right. Now, think of this. You have a faucet at home, and occasionally, it starts to drip. This dripping doesn't mean the faucet is completely broken, but it's a sign that there might be a problem that needs fixing. Similarly, Frank's sign is not a definitive proof that your arteries are blocked, but it is a signal that you should pay attention. So, what should you do if you find this line on your earlobe? First, take a deep breath and don't panic. This mark is a warning, not a sentence. The best thing to do is to schedule an appointment with a doctor. They might suggest tests, such as a cholesterol test or a blood pressure check, to see if there are any issues with your blood circulation. In addition to checking with a doctor, it's a great time to reflect on your lifestyle habits. Think of your health as a car. If you don't perform regular maintenance, it may start to have problems. Eating healthy foods, exercising, and managing stress are like giving your car that regular tune-up, keeping it running well for much longer. Imagine that your body is a garden and you are the gardener. If you take good care of the garden, watering the plants, removing weeds, and ensuring they get enough sunlight, the garden will flourish and look beautiful. The same goes for your body and heart. Taking care of yourself is essential to ensure everything functions properly. In summary, Frank's sign is like a small alarm in your body that may be ringing, asking you to pay more attention to your health. If you notice this line, it's a signal to schedule a medical appointment and get a thorough checkup. By doing so, you'll be taking control of your health and ensuring that your heart and arteries remain in great shape. Before we continue, I noticed that you haven't subscribed to the channel yet. We'll always be bringing alerts to keep you informed about taking care of your heart. 2. Hair loss on the legs. Hair loss on the legs can be an important sign that there is a problem with blood circulation, specifically related to peripheral artery disease, PAD. Let's explore what this means and why it's relevant. When you notice that the hair on your legs is thinning or disappearing, it may indicate that the arteries in your legs are blocked. Peripheral artery disease occurs when the arteries that carry blood to the lower limbs become blocked or narrowed, usually due to a buildup of fatty plaques and other substances. This blockage reduces blood flow to the muscles and tissues in the legs. Blood is essential for the health of the skin and hair follicles. It transports the nutrients and oxygen necessary to keep the hair follicles active and healthy. When blood circulation is compromised due to blockages in the arteries, the hair follicles don't receive adequate blood flow. As a result, The hair on the legs may begin to fall out and not grow back. In addition to hair loss, peripheral artery disease can cause other symptoms, such as leg pain when walking. This pain, known as claudication, occurs because the leg muscles aren't receiving enough oxygen during activity. Weakness. The leg muscles may feel weak and tired due to inadequate circulation. Cramping. Cramping in the legs, especially during or after walking, is common. If you are noticing a decrease in hair on your legs or any of these symptoms, it is crucial to consult a doctor. Diagnosing peripheral artery disease usually involves tests, such as a Doppler ultrasound of the arteries or a blood pressure test in the legs. These tests help assess blood flow and identify blockages. Treatment for peripheral artery disease may include lifestyle changes such as quit smoking. Smoking significantly contributes to the hardening of the arteries. Follow a balanced diet. Reducing the intake of foods high in saturated fats and increasing the consumption of fruits, vegetables, and fiber-rich foods can improve arterial health. Engage in regular physical exercise. Physical activity helps improve circulation and strengthen the leg muscles. If the condition is diagnosed early, you can work with your doctor to develop a treatment plan that helps restore adequate blood flow and prevent more serious complications. So, if you notice hair loss on your legs or experience symptoms like pain and weakness, consider this an important sign. Consult a healthcare professional for a proper evaluation and to discuss treatment options. Maintaining a healthy lifestyle can be crucial for improving blood circulation and preserving the health of your legs. Let me know in the comments what symptoms you're experiencing, and we'll help you. 3. Xanthelasmas. Imagine you're preparing for an important event and, as you look in the mirror, you notice yellowish spots appearing on your eyelids. Your first reaction might be concern about your appearance, but these spots, called xanthelasmas, can have a deeper meaning about your health. What are xanthelasmas? Xanthelasmas are small deposits of fat that accumulate under the skin of the eyelids. They have a yellowish color and can appear as small plaques or spots. Although they don't cause pain, their presence could be a sign of something more serious happening inside your body. How do xanthelasmas develop? To understand why xanthelasmas appear, think of your body as a large system of pipes. Arteries are like pipes that transport oxygen-rich blood throughout your body. When there is an excess of cholesterol in the blood, it can start to deposit on the walls of these arteries, forming plaques that can reduce blood flow. Now, imagine that these cholesterol plaques don't stay only in the arteries. Sometimes, cholesterol can also accumulate in areas like the eyelids, forming xanthelasmas. These deposits are a visible sign that cholesterol levels are high and that your body is trying to deal with the excess. Why is it important to pay attention? Xanthelasmas can be an important warning. They don't appear for no reason. If you see these yellowish spots, it's like your body is giving you a signal that something is wrong with your cholesterol levels. High cholesterol can lead to the formation of plaques in the arteries, a process known as atherosclerosis. This can increase the risk of heart diseases such as heart attacks and strokes. What to do if you have xanthelasmas? If you notice xanthelasmas, it is crucial to take action. The first step is to see a doctor. They can recommend a physical examination and perform a cholesterol test to assess your blood lipid levels. This test will help determine if cholesterol levels are elevated and what risk this poses to your health. Treatment and prevention. While surgical removal of xanthelasmas may improve appearance, the most crucial step is to address the underlying cause, high cholesterol. Here are some practical tips to help control cholesterol and improve heart health. Healthy eating. Reduce the intake of foods high in saturated fats and cholesterol, such as fried foods and fatty meats. Instead, include foods high in fiber, such as fruits, vegetables, and whole grains. These foods help lower bad cholesterol, LDL, and increase good cholesterol, HDL. Physical exercise. Regular physical activity, such as walking, swimming, or cycling, can help keep your heart healthy and improve your lipid profile. Avoid harmful habits. Quitting smoking and limiting alcohol consumption are important steps to keep cholesterol levels in check and protect your heart. If, after making these lifestyle changes, cholesterol levels remain high, your doctor may recommend medications to help manage lipid levels. Xanthelasmas are more than just an aesthetic issue. They can be a warning sign about your heart health. If you notice these yellowish spots, don't ignore the sign. Consult a doctor, get the necessary tests, and take steps to manage cholesterol and keep your heart healthy. Remember, taking care of your heart health is an investment worth making for a long and healthy life. Have you ever experienced any of these symptoms? Show that you care about your heart health and leave your like. 4. Senile arcus. What it is and what it may indicate. The senile arcus is a visible ring that appears around the cornea, the colored part of the eye. This ring can be white or gray and is more common in older adults. While it is often associated with aging, the presence of this ring in younger people can be an important health indicator. How does senile arcus form? Senile arcus results from the accumulation of lipid deposits, or fats, around the cornea. These deposits are usually composed of cholesterol and other substances. Over time, the outer layer of the eye, the cornea, may lose some of its transparency, allowing these deposits to accumulate and form the white or gray ring. Significance in the elderly. In older adults, senile arcus is considered a natural phenomenon. With aging, changes in the corneal cells and the gradual accumulation of lipid deposits can lead to the formation of this ring. In many cases, it is not a cause for concern and is simply a sign of the natural aging process. Significance in younger people. If senile arcus appears in younger individuals, it is a cause for concern. In people under 40, the presence of senile arcus may indicate elevated cholesterol levels in the blood. High cholesterol is a risk factor for various cardiovascular diseases, such as atherosclerosis, which can lead to serious problems like heart attacks and strokes. Why is it important? High cholesterol can cause the buildup of plaques in the arteries, reducing blood flow and increasing the risk of heart disease. Senile arcus can be one of the first visible signs that someone may have cholesterol problems, especially if it appears in younger individuals. What to do if you notice a senile arcus? If you or someone you know has a senile arcus, especially if they are young, it is important to consult a doctor. The doctor may order blood tests to check cholesterol levels and assess the risk of cardiovascular diseases. Additionally, the doctor might recommend lifestyle changes and, if necessary, medication to manage cholesterol levels. Prevention and control measures. Healthy eating. Consume fiber-rich foods, such as fruits, vegetables, and whole grains, and avoid foods high in saturated and trans fats. Regular physical activity. Engaging in regular physical exercise helps maintain balanced cholesterol levels and promotes cardiovascular health. Avoid tobacco and alcohol. Smoking and excessive alcohol consumption can increase cholesterol levels and associated risks. Reducing or eliminating these habits can improve heart health. Regular checkups. Have periodic exams to monitor your cholesterol levels and cardiovascular health. Early detection of issues can help you take corrective measures in time. Senile arcus can be a visible sign of high cholesterol levels and should be taken seriously, especially in younger individuals. Consulting a doctor for tests and adopting healthy habits are crucial steps to protect heart health and maintain cholesterol at appropriate levels. Effective prevention and control of cholesterol levels can contribute to a healthier life and reduce the risk of serious diseases. If you've experienced any of the signs mentioned in the video so far, you should take action to care for your health. A quick and proven solution you can adopt right now is to get your digital book, 30-Day Challenge for a Healthy Heart, 30 Steps to Clean Your Arteries in 30 Days. It's very important to grab your copy now before the units run out. Now, let's reveal the last sign of a heart problem. Cyanosis. What you need to know. Imagine you're at a gathering with friends and suddenly notice that one of them has a bluish tint to their lips. It can be quite alarming, right? This discoloration could be a sign called cyanosis, indicating an issue with blood oxygenation. What is cyanosis? Cyanosis occurs when the skin and mucous membranes, such as the lips and extremities, take on a bluish or purplish hue. This happens because the blood has low oxygen levels, which may signal a problem with the heart or lungs. How to identify cyanosis? Lips and tongue. Check for a bluish or purplish color on the lips and tongue. This can be an indicator that the blood isn't getting enough oxygen. Extremities. Fingers and toes may also turn blue, pointing to circulation issues. Around the eyes. Sometimes, cyanosis can appear around the eyes, especially in more severe cases. What can cause cyanosis? Cyanosis can result from various conditions, including heart problems. If the heart isn't pumping blood efficiently, the blood may not be receiving enough oxygen, leading to cyanosis. Lung diseases. Conditions such as pneumonia or chronic obstructive pulmonary disease, COPD, can prevent adequate oxygen absorption into the lungs, causing cyanosis. Circulatory issues. Any condition affecting circulation, such as vascular problems, can also lead to cyanosis. What to do if you notice cyanosis? If you notice that someone is experiencing cyanosis, it's crucial to seek medical help immediately. Cyanosis can be a sign of a serious underlying condition that requires prompt attention. The treatment will depend on the root cause and may involve treating heart problems. If the cyanosis is related to a heart condition, the treatment may include medications or medical procedures to improve heart function. This could involve drugs to help the heart pump more effectively or procedures like angioplasty to open blocked arteries. Treating lung diseases. For cyanosis caused by lung diseases, treatments might involve medications or oxygen therapy to enhance lung function. This could include inhalers for conditions like asthma or supplemental oxygen to ensure adequate oxygen levels in the blood. Improving circulation. If circulation issues are causing cyanosis, specific treatments might be needed to improve blood flow. This could involve medications to manage blood pressure or procedures to address vascular problems. Preventing cyanosis. To prevent cyanosis and maintain overall health, consider the following steps. Avoid harmful habits. Avoid smoking and limit alcohol consumption, as these can negatively impact your health and contribute to problems that may lead to cyanosis. Quick and effective health management. For an easy and effective way to stay on top of your heart health, consider getting your digital book, 30-Day Heart Health Challenge, 30 Steps to Clean Your Arteries in 30 Days. Supplies are running low, so grab your copy today. Conclusion. Always pay close attention to signs such as cyanosis, which can be a visible indicator of serious issues with blood oxygenation. Observing any changes in skin or mucous membrane color and seeking medical advice can make a significant difference in your health. If you found this information helpful, don't forget to subscribe to our channel and like the video. This way, you'll stay updated with more tips for maintaining your health. See you next time.